The flu, or influenza, is a crafty virus that can really give you the chills. It does not play by the rules, constantly mutating and dodging the best efforts of scientists. This sneaky germ does not care how old you are. It's more than happy to mess with anyone. When it strikes, it's like a wildfire that swiftly spreads from one person to another. It takes a special interest in messing with your respiratory system. Because of its ability to change shape and structure, its treatment poses a formidable challenge to medical advancements, a major reason for the influenza virus being responsible for causing epidemics and pandemics in recent decades. Every year, millions of people get influenza infection. How about we dive into the puzzle of this viral intruder and its symptoms? It's really interesting to uncover how this tiny invader manages to infiltrate the complex systems of larger creatures like us humans. What is influenza? Influenza, or the flu, is a communicable respiratory disease of the upper respiratory tract. When the influenza virus pays you a visit, you can expect some pretty typical symptoms like headaches, body aches, that pesky dry cough, and a sore throat. Every winter, typically from December to February, the influenza virus has its way with a whole bunch of folks, and every now and then, it even takes things up a notch and becomes an epidemic. Alone in America, around 20 to 40 million people get influenza infection each year. Some individuals are higher risk groups for getting influenza virus than others. These individuals usually already have some chronic health conditions. For example, kids and older people tend to be more susceptible to getting hit by these nasty pathogens and falling ill. These age groups can easily catch the flu due to their weak immune system caused by their previous infection or some complications. Human history has witnessed numerous epidemics and pandemics of flu triggered by various strains of the influenza virus. There were 5 major pandemics occurred only in the 19th century, which are remembered as Spanish flu, Russian flu, Asian flu, Hong Kong flu, and swine flu. Causes of flu. The flu or influenza is mainly caused by the influenza virus. This virus has 4 main variants, which can cause flu in humans as well as animals. These 4 categories are labeled as types A through D of the influenza virus. In particular, type A influenza is largely associated with infections in aquatic birds, humans, and pigs. This type A has further subtypes, which are classified on the basis of structural differences in their viral proteins. The most common subtype is called H1N1. This subtype is mainly associated with bird flu and swine flu. Contrarily, the type B influenza virus is the most common pathogenic cause of flu or influenza in humans. However, it may also affect animals, such as dogs and pigs. Both influenza virus types A and B mostly cause severe flu, whereas type C influenza typically causes mild infection in humans, primarily in kids, usually without the appearance of flu symptoms. Finally, the type D influenza virus mainly infects cattle and pigs. Oppositely, to date, the influenza D virus has not been found infecting humans. Transmission. Humans can get influenza virus infection through multiple transmission channels. These methods are direct contact via person-to-person transmission, direct contact via object-to-person transmission, and aerosol inhalation of viral particles. Direct contact of transmission mainly involves the transmission of viral particles through nasal secretions. The flu can make your nose run, and that stuff might have the virus in it. If an infected person touches their nose or eyes, that virus can get on their hands. As a result, the influenza virus can easily spread to other non-infected persons through handshaking. These individuals may later touch their own noses or eyes with their virus-exposed hands. In the same way, contaminated objects, also called fomites, are also responsible for the direct transmission of the influenza virus through non-living objects such as tabletops, floors, doorknobs, or clothes to humans. Suppose an infected person touches their nose and eyes. The virus can get on their hands. Consequently, when this person touches tabletops, floors, doorknobs, or clothes, They easily transmit viral particles to these surfaces, which can be the potential source of influenza transmission to non-infected persons when they obliviously touch these contaminated surfaces. Through extensive genome-level research, scientists have indeed confirmed the presence of influenza viral RNA on roughly 23 to 59% of everyday household and daycare items. Studies have also revealed the potential persistence of infectious influenza virus on paper currency for several weeks. Moreover, aerosol or respiratory transmission of influenza virus mainly occurs through the release of aerosols or droplets of nasal secretions containing virus particles. For instance, singing, speaking, coughing, sneezing, and even breathing may also generate droplets. Coughing may result in the release of several hundred droplets, while a good sneeze can release up to 20,000 droplets. Depending on the expulsion force and size, large air droplets fall on the ground within a few meters vicinity, while small air droplets of 1 to 4 microns in size remain suspended in the air even for longer periods. Therefore, virus-contaminated air droplets may be immediately transmitted to healthy individuals in the vicinity. When a virus enters the human body through breathing, it is held in the upper respiratory tract, where it may start infection. There is a well-known outbreak of influenza virus through aerosol transmission, in which an aeroplane carrying 54 individuals was delayed to the ground for 3 hours. Although a single person was the source of influenza infection in the aeroplane, the ventilation system of this aeroplane was non-functional, which resulted in almost 75% of its passengers developing influenza due to aerosol transmission. Pathophysiology. The influenza virus targets the human upper respiratory tract and results in inflammation, leading to an acute disease. Although the influenza virus disease is self-limiting in most individuals, its symptoms usually persist for 7 to 10 days. Inflammation usually occurs due to an immune response to the infection and the response of interference, resulting in the appearance of symptoms, including fever, body aches, and coryza. Individuals, such as those already infected with cardiac disease, pregnancy, and chronic lung disease, are more vulnerable to severe complications, such as primary viral pneumonia, secondary bacterial pneumonia, hemorrhagic bronchitis, and ultimately, the death of an individual. Signs and symptoms. Seasonal influenza usually results in fever, headache, dry cough, muscular pain, sore throat, runny nose, and severe malaise. The cough of seasonal influenza can be severe and can last for 2 or more weeks. In most cases, influenza symptoms disappear on their own within a week. However, sometimes severe illness and death may occur, especially in high-risk groups. Diagnosis. Numerous diagnostic tests are available to identify influenza virus in respiratory samples from suspected individuals. However, commonly used methods with varied sensitivity and specificity are rapid influenza diagnostic tests, viral culture, rapid molecular assays, immunofluorescence assays, and reverse transcription polymerase chain reaction, in short RTAPC. Rapid diagnostic tests detect viral antigens and produce results within 10 to 15 minutes. Similarly, rapid molecular assays are genome-level tests that detect the genetic material of the influenza virus. These tests produce results within 15 to 20 minutes. Although both these tests are rapid, they are less accurate than other available tests. Contrarily, viral culture is a sophisticated, accurate, and reliable test. However, it is time-consuming and may take days to detect the virus. Compared to all tests, the RT-PCR test takes hours to detect the virus, but it is the currently available influenza virus test with the highest accuracy. Treatment. The flu is usually mild and recovers on its own, without any medical intervention. However, supportive therapy may be recommended to relieve symptoms. The supportive therapy involves taking rest, maximum fluid intake, particular water, paracetamol administration to relieve pain and fever, and taking decongestant medicines to relieve cough. Sometimes, mild flu may progress to severe respiratory conditions. which require immediate hospital admission and emergency treatment to prevent death. After a confirmed diagnosis, antiviral drugs are prescribed for respiratory illness caused by influenza virus infection. Influenza virus subtypes A and B are commonly treated with neuraminidase inhibitors family. Similarly, antiviral drugs belonging to the adamantane family are prescribed for treating influenza a virus. The chances of resistance to these antiviral drugs have been minimal in recent influenza seasons. However, the virus may mutate and develop resistance at any time. Sometimes, respiratory illnesses may not be necessarily caused by the influenza virus, rather, they may be caused by a common cold or bacterial pneumonia. In these cases, antibiotics, not antiviral drugs, are prescribed to reduce and eliminate bacterial infections. Prevention. Vaccination is the best available preventive measure to protect themselves from the influenza virus. However, because the virus mutates and replicates, a new vaccination is required every year to ensure protection. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.